Today on Healthline, we're going to explore some of the physical and psychological hurdles that come with loss of a limb and how perceptions of disability affect recovery. We're here with Dr. Mark Weber of Sinai Hospital of Baltimore and Dr. Donna Walton, a cognitive behavioral therapist who counsels many amputees. Donna, as an amputee yourself, what's the hardest part of coping with the loss of a limb?
Probably adjustment to accepting that the fact that you do have one leg and other person's attitudes towards you and recognizing that you are a person with a disability.
Mark, what can you do to help people prepare for being an amputee?
I think in preparation, knowledge is power for most people, and even before the amputation, I think it's important to give people as much information as you can. Let them know what's going to happen, what to expect, what to be prepared for.
When Healthline returns, we'll have more on the psychological impact of losing a limb. Stay tuned. Welcome back to Healthline. I'm Dr. Kevin Soden, and we're talking about coping with the loss of a limb. What do amputees face? We're here with Dr. Donna Walton, a cognitive behavioral therapist with her own company, LeggTalk, Inc., and Dr. Mark Weber of Sinai Hospital in Baltimore. Dr. Walton, how do you counsel patients? What's the first thing you tell them to help them get on that road to recovery?
Well, there's not one main thing that you actually tell your patients, but the first thing you really work from is an operational model that's empowerment. And that's basically filled with information. And you get them to advocate, so you give them advocacy skills. Because those individuals who are knowledgeable and have information pretty much have a more successful adjustment to their limb loss.
Dr. Weber, what are some of the main causes of amputation?
Well, we like to divide them into two groups, traumatic and non-traumatic. The vast majority of them are non-traumatic amputations, and these are caused by complications from diabetes or peripheral vascular disease. And then the other group being the traumatic amputations are caused by motor accidents and other accidents that can cause amputations.
Donna, you had an amputation at roughly age 17.
Yes.
And at that age, was that really significantly more traumatic at that age versus someone who's older and loses a limb, or do you deal with the same kinds of issues?
I think the issues that you deal with are going to be much more compounded when you're young, because your whole identity is being sort of formed at that point. But later on in life, the issues become the same. It's adjustment, it's acceptance, it's understanding society's attitudes towards you, it's all of these barriers that you have to sort of overcome.
Is there a difference you find between men and women who have an amputation or loss of a limb?
You know, I work with both populations, and I do find that men tend not to be socialized to believe that their bodies are to be to be admired, as women do. Men are more focused on the athleticism, you know, being strong. Women are more focused on how they look and how others perceive how they look. So there's definitely a difference.